Hello, I'm Dr. David Locke, and it's my privilege to introduce to you what orthodontics is all about at Locke Orthodontics. Many people, such as yourself, come to our office because they realize that dramatic improvements can be made to their smile, and they no longer have to be embarrassed or worried about smiling. And thanks to modern technology, it has never been easier to have the smile that you've always wanted. Our patients now benefit from computer-generated systems that allow you to see teeth move before you actually get your braces put on. We want you to truly believe that your experience at Locke Orthodontics will make you smile for a lifetime. Just watch and see.
What a story Rhonda told me when she first visited my office. I was listening carefully when Rhonda asked,
Tell me, what's it like getting braces?
Actually, having braces is pretty fun. At first it seemed really weird. Now I don't even know bad. It's easy and it's fun.
I have braces because my family dentist suggested that I could keep my teeth cleaner and therefore longer.
These stories made Rhonda feel much better, so we decided to take orthodontic records. With these x-rays, photographs, and models, I can study each case individually. Now we're ready to get started. First, we place these small rubber spacers to make room for the molar bands on the back teeth. On the front teeth, as you see on this model, we found small brackets on the front surfaces. This is what a bracket looks like. In the middle, there's a slot for the wire. This is a silver bracket. We also have porcelain and glow-in-the-dark brackets that match the color of the teeth, and a new gold bracket that Rhonda wants. Sometimes I'll make a suggestion based on your needs. On the back of the bracket, we place a little adhesive and bond it carefully onto the front surface of the tooth. At first, the brackets are not in a straight line. That's where the wire comes in. Orthodontists use a special nickel titanium wire that, even when tied in a tight knot, springs back to its original shape. The wire is held into the bracket with little rubber ties. We also use steel ties when we want the wire held more securely. The steel tie is cut off close to the bracket and tucked up underneath the wire. At first, these brackets, wires, and ties might irritate your lips, so we give you some wax that you can place over these brackets that are bothering you. Just pinch off a little piece and place it over the area that is giving you trouble. After a few days, this won't be necessary. When the wire is tied into the bracket, the only way it can get straight now is to move the teeth. Generally, you will have your new smile in about 18 to 24 months. More difficult cases may take a little longer. Some children need early orthodontic treatment. This little girl would have gone years with her two front teeth separated like this, but with only 4 months of treatment, the problem was solved. This patient has very crowded lower front teeth, but there's a baby tooth remaining. This x-ray shows how the space taken by the baby molar is actually larger than the size of the permanent tooth that will soon be erupting. If we remove this baby tooth, the extra space can be used to uncrowd the lower incisors by placing a lower lingual arch. This lingual arch will hold the molars in place and the front teeth will uncrowd. It is important to remember that with braces or appliances, you should visit my office every 5 to 6 weeks.
Sure, no problem.
Once every 5 or 6 weeks? I can fit that into my busy schedule.
Cool. I can miss a little school.
Be careful not to miss your appointments, because here we want to check for loose brackets, change rubber ties, change wires if necessary, and of course review instructions for continued treatment towards your new smile. And as time goes by, just be yourself. You may need to wear rubber bands on occasion. You will put these on yourself. They help move the teeth in the forward and backward direction. Be sure to follow my instructions exactly. Missing only a few days can mean no improvement at all. Brushing is very important too. If dental plaque accumulates around the brackets, you may find white spots on the teeth when the braces are removed. White spots are caused by poor brushing and not by the braces themselves. And don't miss your regular hygiene appointment with your family dentist. Well, time flies and it's an exciting day when you are ready to have your braces removed. Now you'll get a retainer. This is what a retainer looks like. Rhonda will need to wear it every day and not lose it. Continuing education is important for us too. We like to learn from other professionals in our field who help us keep up with what's new. And finally, orthodontists rely on patient referrals to maintain their practice. We would be happy for you to show this video to any of your friends who might benefit from the information. My entire staff and I truly appreciate your support, and we look forward to working with you for a beautiful smile.